These are the best non-medicated ADHD treatments I currently use for my patients and clients. If you don't know who I am, I'm Dr. LeGrand, and I have ADHD and dyslexia and figured out how to be able to manage my own ADHD without using medication. And so for several years, I've been helping a lot of different adults with ADHD with managing their own ADHD without using medication. And so the very first non-medicated ADHD treatment I like to tackle and address, because I feel like this is so common and it shows up time and time again with my patients and clients, is addressing the micronutrient deficiency situation that is so common amongst people with ADHD. And some of the biggest ones that I do see that tend to be a deficient and that you can supplement for are things such as like vitamin D3, magnesium, zinc. Those three are really big ones that will be deficient. Also even iron. I find that a lot of my adult ADHD patients can be anemic, and that can cause a lot of ADHD symptoms. But some of the biggest ones that I see that can be addressed and can easily supplement is looking at vitamin B12 and also vitamin B6. Both of these two vitamins are so critical for people with ADHD because they address with a lot of different neurotransmitters such as like dopamine, norepinephrine, serotonin, things that we do suffer with ADHD. And if they're deficient, you're going to find not only are you going to have issues with focus, but also you're going to have issues with energy. And so that's something I see creep up time and time again with my patients with ADHD. But a few other different micronutrient deficiencies that I like to look at, especially for adults that are 40 years or older, this is when it starts to creep in when you have ADHD symptoms, but also you're experiencing more memory issues, especially like short-term memory issues. If that's you, then it's a good idea to really look at taking something like phosphatidylserine, phosphatidylcholine, because I will see both serine and choline levels tend to be deficient. But another big one, especially if you're suffering with like low energy situation, I also see that it can be beneficial to add like CoQ10 because I will see this deficient in my older patients that have ADHD issues. The second non-medicated treatment that I think is so effective, I see this time and time again with my patients and clients, is addressing the issue with different imbalances in someone's hormones. So actually balancing those hormones can make such a big difference because when hormones are out of balance, they can cause focus issues, low energy, brain fog, and cause memory issues. They can cause definitely mood swings and changes, feeling more anxiety, feeling more depressed. And those are so common amongst people who have ADHD. So if we look at some of the big things that I see with my adult patients with ADHD is helping and balancing, stabilizing things like testosterone, free testosterone, DHEA, which actually builds testosterone, and also estradiol. So first looking, okay, are these out of balance in the first place? And if they are, you better believe that it's going to make a difference when you can improve those levels and get them treated. But when it comes to women, some things that we need to look on top of that is things like progesterone and estradiol. Now, it can also be contributed for males if those levels are definitely can cause some similar ADHD symptoms as well. But two other really big ones to always be addressing that can definitely contribute to your ADHD symptoms is looking at your thyroid that can possibly be contributing to your ADHD symptoms. So a non-medicated way to be addressing this is to see if not only is there a thyroid situation, but there's also peripheral thyroid hormones that our organs do make, such as our liver, our heart, our interstitial tissues, such as like our gut. And so therefore, even if your thyroid hormones, such as like TSH, came back fine, but there could be peripheral organs that are not working optimally. And if you address by focusing on improving those organs, especially through diet, which I'll talk about here in a minute, can drastically improve those thyroid hormones, which will then eliminate a lot of the brain fog, focus issues, feeling low energy, and also the memory issues that you might be having. But the one I definitely see probably common with pretty much every ADHD person I work with is addressing cortisol. Now, cortisol is very vital for us to function throughout the day. It's what gets us up in the morning. It gives us energy throughout the day. But what I will find is sometimes these cortisol levels can be spiked too high, which will make someone with ADHD very stressed and agitated. In fact, sometimes when they're taking their medication, they feel even more agitated and stressed because it's just too much stimulants, especially if they're adding on coffee, caffeinated drinks, anything to just keep them stimulated. It could be a little too much where they can't even function. And so it's very vital to be addressing if it is too spiked, adding things like ashwagandha, rhodiola, those can lower cortisol levels, but there's also the opposite, where cortisol levels can be too low, and it's what we call adrenal insufficiency syndrome, where the adrenals are not producing enough cortisol, enough to function and have energy and focus throughout the day. So a lot of times what I'll need to address here is adding something like adrenal desiccated that can help improve those cortisol levels over time. And the third non-medicated treatment that I find that is so critical also to implement with anybody with ADHD is addressing the gut situation. Now, I don't care if you don't have any gut issues, if you feel like, oh, okay, I don't have irritable bowel syndrome, or I don't have any, diarrhea or any of that stuff, but I guarantee your gut is probably not working as optimally as you think it should. And this is why it's so important to address the gut, because the gut is really what not only feeds the body, it feeds the brain, but also even like 90 to 95% of a lot of our neurotransmitters are made in the gut. And guess what? About 50% or more of our dopamine is made in the gut. So you better believe making sure your gut is working optimally is so vital. And it's probably one of the most important things that I address as a non-medicated treatment that can make all the difference for someone's energy, focus, memory, and just being consistent throughout the day, as if they can address the gut situation. And if you could address that, not only can your ADHD symptoms improve, just your overall health can be a drastic improvement for your life. But the very important thing when it comes to the gut, hormones, micronutrient deficiencies, all these things, you first need to establish, what do you specifically have out of balance? What is the root cause of your own symptoms, of your own body chemistry being out of balance? Because I will say that is by far probably the most effective tool that I use currently with my patients and clients to use a non-medicated treatment, is first identifying what is the problem? What are the imbalances in your own body chemistry? And so when you can identify those things, then you know what to address to help bring everything back into balance. So I have a free ADHD health guide in the description below that talks all about these things and how you can be addressing them for yourself so that you can finally tackle your ADHD in a non-medicated natural treatment that can be effective for you. So like I said, that guide is in the description below. The fourth non-medicated ADHD treatment that I think is so effective as well is when someone is implementing all the good things. Kind of like also all the things that I'm just talking about, and implementing good foods, exercise, you name it. And you probably maybe are one of those people that have been trying all these things, but nothing's working. So you have to think about, okay, what could be sabotaging your health? Well, the biggest one is going to be stress, right? A lot of us deal with it, especially if you have ADHD, you're going to deal with a lot of stress. And if you don't start eliminating those stressors, guess what? It's going to sabotage everything you're trying to do. So when you can break down those stressors, especially when you can identify what is the root of my stress? And a lot of times our brain will protect us from remembering what it was in the first place. And it's probably something way back in your childhood that you buried. And so they get resurfaced all the time. You're like, why am I feeling all this panic attack? Why am I stressed all the time? Well, it's very good to really work with someone that can do either cognitive behavioral therapy or maybe even doing inner childhood therapy to address the root of those stress problems and anxiety that you're experiencing. Because if you don't, I don't care what you're implementing, it's going to make it very difficult for allow the body to heal, for the brain to heal if you don't address that. But once you do and you remove those barriers, then the body can finally heal itself. Because now all the things that you're implementing and you've removed those barriers, then the magic happens. And this is what I see when I'm working with patients and clients, when we address this head on and everything that they've been implementing and we're having them implement starts to finally get results for them. And they're like, wow, I've never felt like this. It's because they never really tackled on the stressors and the root of their stress problem in the first place. And the fifth big non-medicated treatment that I like addressing is transitioning from not relying on supplements. I know I talk about supplements a lot, and they're a great stepping stone, but transitioning from not relying on supplements, but moving towards where food and lifestyle becomes your medicine. And why this is so vital is because this is what is going to give you consistency, to have consistent focus, energy, productivity, motivation, drive, all those things. But remember, like I said before, you got to identify what are those imbalances in the first place and start transitioning to implementing good routines and lifestyle habits, as well as foods that you should be incorporating that are going to be so vital to your consistency with your ADHD. And so it really comes down to, like I said before, is identifying what are your imbalances. So you should watch this video next where I dive in deep talking about how to eliminate your ADHD symptoms with this 3-step system that I use with all my patients and clients. So watch this next.